2 and 3. Okay, now I did that all up here at the knuckles. Now does that mean, can I do it down here at the base? There's less movement, right? But I can still do it.
What about in the middle of the hand?
And do it in the middle then too, right? We can do both things.
So you're alternating pressing between the knuckles?
Yeah, basically one goes up, one goes down.
Okay.
One goes up, one goes down.
You're on the knuckle or between?
On.
On. Okay, I wanted to make sure I had it right in my head.
How do you handle the thumb knuckle?
We didn't get there yet.
I don't know. No.
I was drinking it.
The thumb is its own animal.
Yes, for sure.
Okay? I just want to get her even on both of these metacarpals here. Okay. You can also do that with the whole hand.
Chad, were you trying to work each one of the metacarpals?
Yes.
So all 8 of them you're trying
Yes.
to get in there and feel
Yes.
for each and every one?
Now I'm kind of doing almost the same thing I did with the radius and ulna. And now I can do it down here.
Twisting again.
Yes.
Okay.
Okay? And twist on this side. And we talk thumb. Okay, so for the thumb, unfortunately, there's no way to do this without me bracing it. So I'm going to have to do this side first and then I'll switch. So I brace her hand against my body. Okay? And if you notice, everything can basically kind of become part of my body except for what? This little thumb, right? That just hangs out there. So what I'm going to do is I'm going to make a little joystick.
Oh, baby, she's making faces.
I know.
She loves you.
Okay? And then stir it back the other way.
So you're getting way down into the thin arguments. Way down.
And I'm not putting any pressure through yet. All I'm doing is making a circle.
Okay.
Okay?
So you're not going for range of
And
motion.
that's getting better, isn't it?
Mhm.
Yes, it is. It's getting way more open and not as clicky. Now, I'm going to do exactly the same thing, but I'm going to put a little bit of my weight down into the base of that thenar eminence. She's doing great. Okay, and then we do the same thing we did with the fingers with that thumb. One up, one down, one up, one down, one up, one down, one up, one down. Pistol grip stretch.
Tell us everything you know right now.
This is also a joint lock, but we're applying it as a stretch. Let that go. Then she's going to make a fist. And I'm going to bend the hand down again. That's the forearm stretch and wrist. And flexion stretch. I'm also going to do the flexion stretch on her thumb. And relax. Same thing on this side. So,
Go ahead.
okay. So her hand is part of my core now. The only thing that's not,
Slip things in the steering wheel, and I make myself not do it anymore, but I catch myself doing it. It's dangerous and stupid. Okay. I guess forcing you to start, so here we go.
Yeah, like push up, like push down. Yeah, I think so. I think that's good.
Now you're between the knuckles and he does it on the knuckles. Which doesn't matter. You have instinct. Something you've done forever.
Oh, yeah.
Just keep moving or
It does on the toes.
yeah.
It's great on the
Okay.
There's 5 or 6 women always get together every year. And they always bring little gifts. So I said, foot massage. So I give them each a foot massage. And they're like, oh.
I've seen some people kind of hold the thumb like it's. Grab it. Grab it and stabilize it.
Irene, I'm sorry. Do you need to go behind me? Can you get behind me?
I think his thumb goes behind the wrist.
I can move with my camera.
What's your
Looks like
pistol
a
grip in?
microphone.
No, I think he has what goes around behind the wrist, sort of. Yeah. Yeah. Yeah.
Do you not notice it? It is, yeah. It is kind of stiff compared to these. Look at that, look how that moves. And this is like.
You know what I mean? Like my shoulders, like
Yeah, it's fine.
I need like a serious massage.
I don't know. Did you go back after the pistol grip?
Yep. And then extension with just the thumb.
No, because then you're involved in the whole thing. So you would hold on to the thumb. Yeah, there you go.
And the thumb is the wonderful.
Oh, yeah, like that. No, it's that right there is perfect.
Thank you.
Did I get under you?
Nope, you're doing great.
All right, we started out with the. I think you guys started it. One knuckle up, one knuckle down, all the way. And do one up, one knuckle down. I like it.
Like the same way to make a lot of No.
Have it done.
You know what I mean? No.
You do that.
Was this somewhere?
Yep. Your range, your mobility is so key in, circumventing all of those, neurological inflammations. If you tell your body that you need access to its mobility, it'll do things and release things that will help you, get rid of that inflammation. If you're being really tentative, kind of, avoiding that area, to a certain amount, maybe a lack of mobility in that area, then what's going to happen is the body's going to respond to that lack of mobility. That's going to make it more lack of mobility, and it's going to make it harder and more painful to make it mobile. So it's a big cycle. You always want to promote a positive cycle, which is movement. So any small amount of movement that you can get arthritic joint is always going to benefit.
And then you go in, okay, then I remember two more things. Then you go in the base of it and do the same thing, and then he's in the middle of it and do the same.
It's hard to say. Right. So, I mean, if you went to a doctor, they would probably tell you it's a type of carpal tunnel because it's a pain in the hand that they don't have a name for. So, kind of the same way if you have bodily inflammation that they don't know how to call it, they'll call it fibromyalgia. If you have a joint inflammation, they'll add itis on the end of it. Call it a bursitis or tendinitis. Okay. Fist.
Right, and then you go one up and one down.
And that way it gets the blood flowing into that. I haven't done me, I haven't really studied it.
There we go. That's good that we're not sitting correct. Now your thumb is sitting on the wrist correctly. Good. Good. Thumb particularly. A little more mobile, right? A little less pain. That was a little bit more junction between this part of the wrist, the carpals, and the base of your thumb.
That's what I understand.
Really, this whole junction right here is getting stuck. So these, the wrist, keep that part of the wrist open. Then these, keep the hand open. And then this for the thumb. All that's great for you. So, I mean, if we're going to do that by yourself, start here.
These are flash puppies. Flash puppies.
Anchor your hand on your leg.
Pardon me? Yeah.
Reframe my brain. I'm so much happier. I wouldn't have all those 1950 beer commercials.
That should help a lot. Fingers as far as postural manipulation. Now, I see a lot of finger stuff because one of the martial arts I teach is the Filipino stick fighting art, and people are hitting each other's hands all the time. People are, anywhere from basically the elbow down, you can get hit pretty hard with a stick, and when you get hit with a stick, it tends to move things around a little bit. Bones, muscles, tendons. So I see a lot of fingers, and I see a lot of fingers that come in and they're standing like this, and the fingers pointed this way. They're standing like this, and the fingers pointed straight up. So, when you see stuff like that, it's a whole lot different than if the person's hand looks normal and you're just trying to fine-tune what's going on with their fingers. There's a big difference in that. The manipulations aren't any different though. If I see the fingers pointed out to the side, I'm still doing the same manipulation. It's just going to be a bigger manipulation to bring the hand back. So what we basically do is we start at the carpophalangeal joint, and we're going to do all the ranges from this point. We're going to pull, we're going to twist out, we're going to twist in, and we're going to flex, and we're going to extend. Okay? Then we move down one joint. Okay? we're going to pull. We're going to twist in, twist out, flex down. Now these won't bend up, right? So that's called hyperextension. And then we come out to the last. Okay? We got to pull. Twist in, twist out, bend, and hyperextend. Okay, and that finishes that finger. We'll give it a good pull. What's the one requirement of a good finger pull?
Consistent, steady.
And it's got to pop off their fingernail. Alright?
It's got to pop off the fingernail, so you
Yeah,
feel
why?
kind of like a snap.
Rhoda asked why. I mean, I can answer it, but anybody else know why?
Release the stuck chain in the meridian.
Release the stuck chain in the meridian.
Same reason
So
you.
we got to pull, twist in, twist out, flex, extend. Pull, twist in, twist out, flex, and extend. Pull, twist in, twist out, flex, and extend. Yep. Okay, now notice when I was doing these outer two hands, what hand was I using? My left, because that's where those fingers are. When I get in here closer to these inner fingers, what am I doing?
The other hand.
Right. Okay, so same thing. Pull, twist in, twist out, full flexion, full extension. Pull, twist, twist, flex, extend,
Very little disease.
pull, twist, twist, flex, extend. Almost get to his thumb. That's what he's up here for.
So you do that for trigger fingers, right?
Yeah.
That would fix it, or?
I mean, it's going to open the energy so that your acupuncture will fix it. I mean, I would say that the TuiNa would probably, on its own, would probably open up the energy flow, but if there's a pattern, the pattern's going to reverse it. If you open it up with the TuiNa and then you do some needles, I would say you're, readjust the pattern.
And ripped tendons?
Percentage torn?
Total.
Total surgical reattachment.
But you would do
If you say torn 90%, there's 10% there. Yeah, we can work on that. We can get them. We can probably get them 50% pretty quick. All right, thumb. Same exact thing that we just did with the other fingers. Starting at the base, pull, twist in, twist out, flex, and extend. Down one knuckle. Pull, twist in, twist out, flex, and extend. That's one of the sticky spots. Out to the furthest knuckle, pull, twist in, twist out, flex, and extend. Now, that's the majority of what I do for the fingers. The other one, just hold your hand up so that people can see it. The other one is this. Sometimes I like to bend those small joints to the side. Okay, now there isn't a range of motion that way, but sometimes what that does is it finds connections through these bones that need to be made. And when I was doing, even though I was bending up here, his whole knuckle of his index finger made a slight manipulation. Okay, so same thing. Might go side to side a little bit to see if that changes his thumb a little. Also doing a little bit of spreading here, just to open the fascia up. And everybody's always talking about large intestine 4, and that's ways to stimulate large intestine 4. I like to turn their hand palm up, grab the base of their thumb and the back of the hand in that tiger's mouth, and work from the base the whole way out through the muscle. That way you get all the fascia that's surrounding large intestine 4, not just large intestine 4. There we go. Now that's a lot more. What we're going to do is left thumb too, just because he's okay, so when you're with your partner, you're going to do each of their fingers. Pull, twist in, twist out, flex, extend. Yeah. That's primary. I mean, like I said, I would probably go 1, 2, 3 each on these distal points. But if I had to pick just 2, I'd take those 2. Fingers are sensitive. Make sure you got your sensitivity hat on.
Which side? Crack down. Stuck?
Yeah.
I shouldn't see too many grimaces.
A lot more grimaces?
No, I shouldn't see too many grimaces. You know, okay, working pretty hard.
We've been using your middle finger too much. All 10.
Let's see.
Right. Yes, outward. That's why you eat all this stuff, to clear it all out.
This one I literally it's only when you get to the edge that this is dip joint. So it's very yes. That's fine. It's just too much flexion.
Twisting. He works all
Really?
When you're working right on the I mean, I like it, feels good, but I
There you
Twisting on the joint.
started him or you're on your second? You started him or you're on your second? Just trying to engage where we're at.
Are you treating your nerve trigger? You're in the What do you inject?
No, I use,
Same type of 30 seconds, and then let's finish up the hand. We can talk.
I thought they said they wired it.
Okay, let's bring it back. So really quick, I want to talk shoulder for a second. Yes. Everybody's been saying shoulder, 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 so let me talk shoulder for a second. But I need a shoulder guinea pig.
I love these.
I heard please. You can be second. All right, I'll be second. That's what happens. Somebody jumps on the table.
So many shoulders.
If I really needed somebody on the table, nobody would want to come on, right? Okay, so think about shoulders. Shoulder's not really shoulder. Shoulder's shoulder, plus its collarbone, plus its scapula. Okay, so it becomes kind of this whole regional thing. And the other thing about the shoulder is by far, and I said this in my lecture last year on the shoulder, shoulder is by far the most difficult joint to deal with, okay, for those reasons. If you can get the joint itself sitting straight, then you got a problem with the scapula. If you can get the scapula straight, then the collarbone's off. If you get the collarbone straight, then the joint's back out again. So it's very, very difficult to get it all where it's supposed to be at the same time. Now the great thing about it is that if we can get it there as an acupuncturist, and then we can have them rest and stick a bunch of needles in it, we can probably get it to stay where we want it to stay. Okay, so that's kind of the saving grace. She's got a little elevation on her collarbone on the right side. That translates to a little elevation here at the claviculoacromial joint. And this, I don't know if you guys will visually be able to see that, but this should be a little higher than this is. Okay? So, I'm going to prop my leg against her body because I don't want her body to have any shifting. And she's going to lean back like I'm a chair. Then I'm going to place the base of my thumb on her clavicle, her collarbone, to make sure that basically everything except for the shoulder joint itself is immobile, okay, or close to it. I'm going to let her right arm relax, and she's just going to try to keep it as relaxed as possible the whole time. My metaphor is usually like a wet noodle, like a wet spaghetti noodle. Just let it hang as much as you can. Now, if you remember what we did in Qigong, shoulder rotates forward, all right? And shoulder rotates backward.
She's wincing a little bit with her left arm. Okay?
Okay, now she's helping me, and that could be why she's wincing. Let's try one more time. If you can, try to disconnect yourself from that arm. Relax. It's not there. I'm not here. None of these people are here. Okay, and let me hold it. So more, you're still holding. Yes, there you go. So now, I have her arm, and what I'm doing is I'm pushing her shoulder into her shoulder joint. And while I have that little bit of pressure in, that's when I'm making this rotation. And right there it went, because her arm was relaxed that time. Now, after we finish that one, then we take a look again. Where is this now? Okay. That was way too easy. A lot of times it's not that easy. I mean, clavicle feels pretty good. Sometimes I might, in her case, do a little bit of clavicle work just to make sure that the clavicle is moving how it's supposed to. Musculature around her scapula feels good, so I don't think we have to do anything for scapula. So let's do clavicle on you too. Put your feet here, face up.
Were you pushing down on the clavicle when you were?
Just stabilizing, like a stabilizing push, not pushing hard. Head to your feet there, face up. Upward, and the clavicle rotates downward. Okay? So all I'm going to do is help her body do those same ranges. So I'm going to, again, make a contact on the clavicle, and as I push the clavicle, or the arm in, I'm going to push the clavicle medial towards the center line. And you'll feel it. Like if I'm just here and I just touch her clavicle and I push like this, I feel it sliding under my fingers towards her center line. That's where it wants to go. And I help it. And now when I go out, it feels like it's sliding out, so I help it. So I'm just going medial and lateral. Okay? Upward rotation. Now, for most people, if I put her arm here and I just push down a little, see how her clavicle rolled? That's all you need. If that's all I get, that's all that has to happen for her clavicle to roll upward. Okay? Same thing downward. If all I do is push this down, see how the clavicle rolled down. So all I'm going to do is when it's rolling up, I'm going to assist it upward. And when it's rolling down, I'm going to assist it down. Okay? Now, sometimes this little range of motion is not going to work. If you guys did this on me, I have hyper flexible shoulders, and so you're going to get to here, you're not going to see anything. You're going to pull my arm down to the floor, you're not going to see anything. So you have to start to find ways that you can get mobility out of people that have hypermobility. Now we're getting back into our martial arts lecture here. So if I hook my arm under, and now I roll, see how I'm picking up the elbow, and immediately that translates into more range of motion in her clavicle. Now you don't want to do this too much because this is a throw and this is a shoulder dislocation. If I would take it too far, it's just going to pop out. Okay? So all I'm trying to do is just get this. Just this little rock so that I can assist in helping that clavicle rock upward with my finger. And then I reverse it. Same thing. I could torque this down, and again, right away, you see the clavicle start to jump up, and that means I can pull a little bit down. clavicles ranges medial, lateral, upward rotation, and downward rotation. Okay? And then if you could, just swing your legs off the side over there again, and let's take a look. Stay right where you're at. So, now the head of the clavicle is where it's supposed to be. Claviculoacromial is nice and balanced. Okay? So, that kind of gets our shoulder a little bit. Let me borrow you. So you can see it on the other side. I block off this side, make sure he can't move. He leans back like I'm a chair. And I put just a stabilizing pressure down on his clavicle. Okay? If I don't do that and I start to make these circles, what happens? Yeah, the shoulder shrugs. Okay? If I keep this here, keep this arm as relaxed as you can. Yes. Now the clavicle stays where it is and the shoulder joint moves. Give it to me a little bit more. Right there, yes. Thank you. And backwards. Good. Now for him, because he had a little more popping and cracking going on. This is a shoulder stabilizer. This makes sure the head of the humerus is in his glenoid fossa. All I do is push on a 45-degree angle straight into his base. And then I pull this straight back. Okay, relax the arm. Okay, claviculoacromial is good. Maybe I should do the left clavicle, but I think it's okay. And like I thought, his scapula on this side is what's causing a lot of this pull. Okay?
Yeah, I often get pains in there.
His lats on this side are tighter. His rhomboids on this side are tighter. His traps on this side are tighter.
Are you left-handed?
Nope.
Okay. So probably easiest for you to see his face down. Go face down.
Okay. In there? Like that?
Yeah, that's fine. You can turn your head to the side, whatever's comfortable.
That's what.
Yeah, good. Hold that.
All right, yeah.
Yeah.
That's better.
Okay, so that you can see this. Now, again, this would be one of my preferred things to have him face up with my hands underneath of him so that I don't talking and you guys wouldn't be able to check it out. So what we're going to do is we're going to work. Now, in the beginning, what I usually try to say is leave the arm flat. Now, look at that scapula. Okay? Now I can get these fingers in here and stretch the rhomboids. Okay, now, I see some faces looking around and everybody's kind of going like this. You can literally hang your entire body weight off of this and there's no chance that you're going to hurt the person. Okay? And I've done this. You know?
Is that everyone or is that just him?
No, everyone. When you put this hand back here, it flares your scapula back and allows you to get underneath it here. This is the only way for you to massage the soft tissue of the subscapularis muscle. Subscapularis is under the scapula. So if you can't get your fingers under there, there's no way you're massaging that muscle.
That feels great.
Okay? And all I'm doing is just going along the medial border. Just trying to loosen that medial border up. Okay? Once the medial border is loose, then I double check the lateral. And then I want to do a rock between the two. Okay? And that means his scapula is now floating. Okay, instead of being stuck.
Do you still put his arm underneath him if he's supine?
No. That changes to the effect that when they're face up, you can manipulate the scapula however you want to because it's in a free position. So you don't really need the hand behind the back. This just helps when they're face down. We get a little bit on the top supraspinatus and the traps. Just make sure they're loose. And then hand back down. Now, we didn't talk about this for almost any of the stuff we did today, the core, the elbow, wrist, hand. Don't forget your acupressure points. Okay, part of the reason that TuiNa works really well is because you guys have a better understanding of points and energetics than most people do. I teach a lot of TuiNa to massage therapists, and they gain the postural manipulations and they gain the difference in hand techniques. There's so many different hand techniques in TuiNa. It's great for most massage therapists because it gives them just hundreds of variations. You can always find a different way to work a different part. But for you guys, being able to say, here, just tuck this under your leg so it doesn't fall. For you to be able to say, okay, I'm getting ready to work on this. Let me open the shoulder up with small intestine 9, small intestine 10, small intestine 11, 13, 12, gallbladder 21, large intestine 16. If I do all these points, what's the scapula going to do? It's going to just rise. Okay? So if you know you're having difficulty on that area, use what you know. You don't necessarily have to stick needles in all those points. Just hold it for 30 seconds. Okay? And even though I did all of that massage around his scapula, 11 was still really tender. Okay? 11 is the control point for the scapula. Really, really important that you're kind of keeping all of this information as one unit. It's not TuiNa is separate from acupuncture. It's all the same stuff. Same as herbs, same as qigong, same as diet therapy. It's all the same. That's why you should be using it all. Okay? I see all these people who tend to specialize. I'm an acupuncturist. I'm an herbologist. It's all together. You don't have to be one of anything. You can use it all at the same time. Much better. And let's have you sit on the edge again, just so we can double. Let me go back down where I wanted to, so I would want to work on that a little bit. Let's lay face up real quick.
Yeah, it's actually tender on this side. Really tender.
So I'll stand on this side. Again, one of the things that I'm really big about, and the more you see me in TuiNa classes, you'll know, is I don't want you to copy me, okay? Because I do things my way for my body. My body's long and lanky. Your body might be short and stocky. If you try to do my techniques with your short, stocky body, it's going to feel horrible, okay? So what you need to do is you need to see the concept of body motion, and you need to translate that into whatever works for you. Normally, I might stand on the same side as the clavicle I want to work. Doesn't mean I couldn't stand on the opposite side. Maybe my treatment table is in a community acupuncture room and it's pushed up against the wall. So I can't walk over there and I can't do the clavicle from that side. So I'll stay here and I'll do lateral and medial. We'll do it from this side and still get the same ranges. And one that's really important for him is going to be downward rotation. Upward climb. There we go. Now for him, I don't need the extra twisting and things like that, because if you look, if I get to about here, it's starting to activate his clavicle. And when I get to about here, it's starting to activate his clavicle. Okay? So I don't need any extra range. It's already there. Good. And one more time, sit up just so we can make sure you're 100%. There. Now the clavicle's sitting down into the sternum.
It's painful.
Yeah, it's not as tender anymore.
This is good. And his musculature is clear. So a little bit of the shoulder. So you guys can kind of see shoulder. Thank you very much.
For a cancer, but that's just hanging this up.
This is a free hanging joint. Okay? No way to get around that with the shoulder. Hip's much easier to deal with because it's a ball and socket that goes into the hip and all the muscles keep it there. Okay? Elbow and knee are pretty much the same. Okay? With the exception of the medial collateral ligaments, which means that on those, let me have you over here real quick. Where do you diaper?
Diaper up.
So, which knee's more effective? Right. Okay. So, if I'm doing my internal and external rotations, it's still pretty much like the elbow, correct? I just have to be really careful right here, where I have pressure into this medial collateral. Okay? And then if I do it opposite, I have to be really careful right here to make sure I'm not over pushing and injuring the lateral collateral ligament. Okay? But the knee looks pretty much like the elbow, right?
That's her good knee though, right?
3 flexions.
Yeah, yeah. That's her good knee.
Yep. Crunchy. Very crunchy. There we go, Les. One more. Les. And reverse. And here's the one we're looking for. Go slow. She's holding her. I'm okay. I'll be nice. Yes, there we go. There we go.
Looser.
Less.
Yeah.
Okay. And then flexion 1, flexion 2, flexion 3. And then again, I would probably do spleen 9, spleen 10, stomach 34, stomach 36. Okay, just to open up and you flow in the knee. Okay, but knee's very much like elbow, right? Rotations in and out, flexions. Okay, we kind of combine the extension part of the knee with our internal and external rotations. Okay.
Just an interesting observation because I have a lot of soft tissue, like a, it's not a cyst or anything, it comes and goes. But after doing that, this is down. So that's good. Thank you.
You're welcome. Wrist and ankle are parallels. Ankle is, I say it's easier because it's more defined. The ankle bones are much, much easier to get at one at a time. And so we adjust the talus with a very specific manipulation. We do the calcaneus with a very specific manipulation. We do the navicular, we do the cuboid. So we can get to each one of those bones, whereas the wrist is a little bit more kind of feel it out, and it's a little more free form. The ankle's a little more defined, but the motions and the things that you do are pretty much similar. And if you look at the ankle and the wrist, you see that the wrist has a lot more just free form range of motion. The ankle's kind of in a specific range. It has a little bit of side to side, but it's mostly flexion and extension. Foot and hand are the same. Fingers, toes are the same. Okay, they don't really change that much. Any quick questions?
So that whole thing with the twist inside and then down, you do the toes? And that would
Yes.
Okay, that'd be
Yes.
nice.
And again, same thing. I see lots of broken toes and toes that come in off at weird angles, and that's what you do. And a lot of times, you might have to do this kind of like a finger or toe protocol to an injury like that. You might have to do it 5-6 sessions in order to get a full change in what's going on. I mean, I'm not saying that if the finger's off to the side on the first day, that I'm trying to adjust it, you know, or manipulate it the whole way back to straight. But that's always your progression. That's always what I'm looking for. And if the body allows it to open up and allows it to do that, that's great. If it doesn't, then you go for it in the next session. Or you try to get some acupuncture to open it up so that
I was
maybe
gonna
at the end.
say, for needling with TuiNa, is it before or after? Just
Either or. And if you listen to my first lecture on the core, I suggested TuiNa before, just simply because that's how I tend to use it. To me, especially if I'm doing kind of a core manipulations thing, I see it as clear out the body's structure so that whatever I'm going to do energetically has its maximum power. Okay? I want the energy channels to be as open and flowing when I stick needles in as possible. Same reason that if I have a person who's on the table and they're like totally stressed out and they're pulling their hair out and they're messing with their phone, I'll look at them and I'll say, give me your phone. give me your BlackBerry, whatever. I'm going to step out of the room for a minute. Don't worry, I'm walking over to throw your phone out the window. And by the time I come back, I want you to calm down and relax. You know, and sometimes I'll do that to let them have a minute before you start to work on them. Same thing for TuiNa. If the person's all bound up and their posture's all off, it's going to affect your acupuncture treatment in a negative way. Whereas if you can get them open and relaxed, I had a person who came in and they were like, oh, I've been trying to do this whole no sugar thing and this is driving me crazy. And I was like, here, have a piece of chocolate. I had a piece of chocolate laid on the table. We had one of the best treatments they've ever had. You know, and it's like sometimes you just have to remember, what is it going to take to let this person relax? TuiNa works great. That's part of the reason I focus on it, because when you touch somebody, you get a connection with them, they start to relax, and they trust you. And then whatever you're going to do with your acupuncture, whatever you're going to tell them about their diet, whatever you're going to tell them are herbs that are good for them, they're way more likely to take your advice. Okay? If they're tense, they're stressed, they just can't seem to let go, you can suggest the best things in the world for them, and they're not even going to hear you. Okay? It's just going to go right past them. I have some business cards that I'll lay up here. I encourage you all to take one and email me. If I get an email from you, I'll put you on my email list, and whenever I do TuiNa seminars, I also do retreats. We go to Costa Rica, do Tai Chi and Qigong and TuiNa for 5-6 days, and whitewater rafting, that kind of stuff. So if you're interested in any of that, throw me an email and I'll make sure you're on my email list.